Hi, my dear students. Now let us discuss remaining MCQ from respiratory system. So here we have the first question. The exchange of gases between alveoli and capillaries is known as. The exchange of gases between alveoli and capillaries is known as. Option A, internal respiration. Option B, external respiration. Option C, cellular respiration. Option D, pulmonary ventilation. Option A, external respiration. Option B, option A, external internal respiration. Option B, external respiration. Option C, cellular respiration. Option D, pulmonary ventilation. The correct answer is option B, external respiration. External respiration is the exchange of gases between alveolar air and blood in lung capillaries. The external respiration is the exchange of gases between alveolar air and blood in lung capillaries. The next question. The trachea branches into right and left bronchi at the level of. The trachea branches into right and left bronchi at the level of. Option A, larynx. Option B, fifth thoracic vertebrae. Option C, fourth thoracic vertebrae. Option D, fifth thoracic vertebrae. Option A, larynx. Option B, fifth thoracic vertebrae. Option C, fourth thoracic vertebrae. Option D, fifth cervical vertebrae. The correct answer is option B, fifth thoracic vertebrae. The trachea divided into two bronchi around the level of fifth thoracic vertebrae. The main purpose of respiration is to. The main purpose of respiration is to. Option A, provide oxygen for energy production. Option B, eliminate nitrogen from blood. Option C, absorb carbon dioxide. Option D, maintain body temperature. The main purpose of respiration is to. The main purpose of respiration is to. Option A, provide oxygen for energy production. Option B, eliminate nitrogen from blood. Option C, absorb carbon dioxide. Option D, maintain body temperature. The main purpose of respiration is to. The correct answer is option The correct answer is the main purpose of respiration is to. The correct answer is option A, provide oxygen for energy production. The next question, which of the following structure is commonly called Adam's apple? The next question, which of the following structure is commonly called Adam's apple? Option A, epiglottis. Option B, thyroid cartilage. Option C, cricoid cartilage. Option D, trachea. Which of the following structure is commonly called Adam's apple? Option A epiglottis, option B thyroid cartilage, option C cricoid cartilage, option D trachea. The correct answer is option B thyroid cartilage. The thyroid cartilage forms a prominent projection known as Adam's apple, especially in males. The next question. Which of the following is a chronic obstructive lung disease? Which of the following is a chronic obstructive lung disease? Option A tuberculosis, option B emphysema, option C pneumonia, option D lung cancer. Which of the following is a chronic obstructive lung disease? Option A tuberculosis, option B emphysema, option C pneumonia, option D lung cancer. Which of the following is a chronic lung disease? Option A tuberculosis, option B emphysema, option C pneumonia, option D lung cancer. The correct answer is option B emphysema. Emphysema is a chronic obstructive pulmonary disease where alveolar walls are disturbed, reducing gas exchange. The next question. The nasal cavity is divided into two halls by. The nasal cavity divides into two halls by. Option A nasal septum, option B hard palate, option C soft palate, option D concave. The nasal cavity is divided into two halls by option A nasal septum, option B hard palate, option C soft palate, option D concave. The correct answer is option A nasal septum. The nasal septum separates the nasal cavity into left and right chambers. The next question. Which structure prevents the collapse of alveoli after exhalation? Which structure prevents the collapse of alveoli after exhalation? Option A surfactant, option B pleural fluid, option C mucus, option D cilia. Which structure prevents the collapse of alveoli after exhalation? The correct answer is option A surfactant. The surfactant is a lipid-rich substance secreted by alveolar cells that reduce surface tension and keep alveoli from collapsing. The next question. Which of the following is not a function of respiratory system? Which of the following is not a function of respiratory system? Option A gas exchange, option B voice production, option C blood circulation, option D regulation of blood pH. Option A gas exchange, option B voice production, option C blood circulation, option D regulation of blood pH. The correct answer is option C blood circulation. Circulation is a function of cardiovascular system. It is not a function of respiratory system. The next question. Which of the following increase the breathing rate? Option A decrease in carbon dioxide, option B increase in oxygen, option C increase in carbon dioxide, option D increase in hydrogen ions. The correct answer is option C increase in carbon dioxide. High levels of carbon dioxide stimulate the medulla oblongata to increase the breadth and depth of breathing. The next question. The lungs are covered by a double membrane called option A peritoneum, option B pleura, option C pericardium, option D. The correct answer is option B pleura. The pleura is a double. Then which condition is characterized by inflammation of bronchi? Option A pneumonia, option B bronchitis. The correct answer is option B bronchitis. Bronchitis is an inflammation of the bronchial tubes often caused by infection or irritation. The epiglottis is made up of what type of tissue? Option A bone, option B muscle, option C cartilage, option D epithelial tissue. The correct answer is option C cartilage. The epiglottis is a flap of elastic cartilage that closes during swallowing to prevent food from entering the trachea. The main pathway for air to enter the lungs is the option A pharynx, option B trachea, option C larynx, option D diaphragm. The correct answer is option B trachea. The trachea or windpipe carries inhaled air from larynx to the bronchi. Then the amount of air that can be forcefully exhaled after normal exhalation is called option A residual volume, option B tidal volume, option C expiratory reserve volume, option D vital capacity. The amount of air that can be forcefully exhaled after normal exhalation is called option A residual volume, option B tidal volume, option C expiratory reserve volume, option D vital capacity. The correct answer is option C expiratory reserve volume. Expiratory reserve volume is the additional air that can be exhaled after normal breathing out. The next question, which condition is known as inflammation of the pleural membrane? Which condition is known as inflammation of pleural membrane? Option A pleurisy, option B pneumonia, option C bronchitis, option D emphysema. Which condition is known as inflammation of pleural membrane? The correct answer is option A pleurisy. Pleurisy is the inflammation of pleura causing short chest pain during breathing. The next question, which part of the respiratory tract is responsible for warming and filtering air? Which part of the respiratory tract is responsible for warming and filtering air? Option A trachea, option B nose, option C larynx, option D bronchi. The correct answer is option B nose. The nasal cavity filters, warms and moistens air before it reaches the lung. The next question, which of the following best describes tidal volume? Option A air remaining after deep exhalation, option B air inspired and expired in one normal breath, option C maximum air inhaled after normal inspiration, option D maximum air exhaled after deep inhalation. Which of the following best describe tidal volume? The correct answer is option B air inspired and expired in one normal breath. Tidal volume refers to amount of air moved in or out of lungs during normal breathing. The next question, which of the following diseases cause constriction of airways due to allergens? Which of the following diseases cause constriction of airways due to allergens? Option A tuberculosis, option B asthma, option C pneumonia, option D emphysema. Option A tuberculosis, option B asthma, option C pneumonia, option D emphysema. Yeah, the correct answer is option B asthma. Asthma causes narrowing inflammation of the airways triggered by allergens or irritants. The next question, which part of the brain controls rhythmic pattern of breathing? Which part of the brain controls rhythmic pattern of breathing? Option A hypothalamus, option B medulla oblongata. The correct answer is option B medulla oblongata. The medulla oblongata regulates automatic breathing by responding to blood gas levels. The next question, which structure connects the nasal cavity and oral cavity? Which structure connects the nasal cavity and oral cavity? Option A pharynx, option A larynx, option B pharynx, option C bronchus, option D trachea. The correct answer is option B pharynx. The pharynx serves as a common passage for air, respiration and food, that is for digestion. The next question, which gas diffuses from blood to alveoli during external respiration? Which gas diffuses from blood to alveoli during external respiration? Option A oxygen, option B nitrogen, option C carbon dioxide, option D hydrogen. Which gas diffuses from blood to alveoli during external respiration? Option A oxygen, option B nitrogen, option C carbon dioxide, option D hydrogen. Which gas diffuses from blood to alveoli during external respiration? The correct answer is option C carbon dioxide. Carbon dioxide moves from the blood to alveoli to be exhaled from the blood. The next question, the respiratory process that occurs inside body cells is called. The respiratory process that occur inside body cells is called option A cellular respiration, option B external respiration, option D pulmonary respiration, option D gas exchange. The respiratory process that occur inside the body cells is called. The correct answer is option A cellular respiration. Cellular respiration is a process by which cells use oxygen to produce energy and release carbon dioxide. Which muscle assists the diaphragm during breathing? Option A intercostal muscles, option B abdominal muscles, option C deltoid muscles, option D pectoral muscles. The correct answer is option A intercostal muscles. The intercostal muscles between ribs help expand and contract the thoracic cavity during breathing. Which structure acts as a passage for air between pharynx and trachea? Option A bronchus, option B larynx, option C nasal cavity, option D alveoli. The correct answer is option B larynx. The larynx connects the pharynx to the trachea and also houses the vocal cords. The next question, the term dyspnea refers to. The term dyspnea refers to option A breathing, option B difficulty in breathing, option C shallow breathing, option D absence of breathing. The correct answer is option B difficulty in breathing. Dyspnea means shortness of breath and labored breathing, a common symptom in respiratory diseases. Then the respiratory center in the brain respond mainly to which component? Which blood component? Option A oxygen, option B carbon dioxide, option C nitrogen, option D hydrogen. The respiratory center in the brain respond mainly to which blood component? Option A oxygen, option B carbon dioxide, option C nitrogen, option D hydrogen. The correct answer is option B carbon dioxide. The next question, pulmonary surfactant is secreted by which type of cells? Option A type 1 alveolar cells, option B type 2 alveolar cells, option C globate cells, option D ciliated cells. The correct answer is option B type 2 alveolar cells. Type 2 alveolar cells secrete surfactant to reduce alveolar surface tension. The functional unit of lung is option A bronchus, option B alveolus, option C bronchial, option D pleura. The functional unit of lung is option A bronchus, option B alveolus, option C bronchial, option D pleura. The correct answer is option B alveolus. Alveoli are the sites of gas exchange, making them the functional unit of the lungs. The uppermost part of the larynx is called option A oropharynx, option B nasopharynx, option D laryngopharynx, option D epiglottis. The correct answer is option B nasopharynx. The nasopharynx is the upper part of the pharynx connecting to the nasal cavity. The largest cartilage of the larynx is option A cricoid cartilage, option B thyroid cartilage, option C arytenoid cartilage, option D epiglottis. The correct answer is option B thyroid cartilage. The thyroid cartilage forms the Adam's apple and is the largest cartilage of the larynx. The normal respirator for a child is approximately option A 12 to 20 breaths per minute, option B 20 to 30 breaths per minute, option C 30 to 40 breaths per minute, option D 40 to 50 breaths per minute. The correct answer is option B 20 to 30 breaths per minute. Children have a faster resting respiratory rate than adults. Which disease is caused by obstruction of the airways due to spasm or inflammation? Option A emphysema, option B asthma, option C tuberculosis, option D pneumonia. The correct answer is option B asthma. Asthma involves bronchial constriction and airway inflammation. Which respiratory structure contains cilia to trap and move particles? Option A alveoli, option B trachea, option C larynx, option D bronchi. The correct answer is option D bronchi. Bronchi are lined with ciliated epithelium that moves mucus and trapped debris upwards. Hyperventilation decreases which blood component? Option A oxygen, option B carbon dioxide, option C nitrogen, option D glucose. The correct answer is option B carbon dioxide. Rapid breathing expels carbon dioxide faster than reducing its blood levels. Which of the following is the passage for both air and food? Option A larynx, option B pharynx, option C trachea, option D bronchi. The correct answer is option B Pharynx. Pharynx functions as a common passage for respiratory and digestive system. Which disease is caused by bacterial infection in lungs? Option A asthma, option B tuberculosis, option C emphysema, option D bronchitis. The correct answer is option B tuberculosis. Mycobacterium tuberculosis infect lung tissue and causing TB. The total volume of air that can be exhaled after maximum inhalation is called option A tidal volume, option B vital capacity, option C residual volume, option D expiratory reserve volume. The correct answer is option B vital capacity. Vital capacity is the maximum air volume exhaled after deep inhalation. Which lung is smaller due to presence of heart? Option A right lung, option B left lung, option C both, option D depend on each. The correct answer is option B left lung. The left lung has two lobes and is smaller to accommodate the heart. During exercise, which of the following increases? Option A residual volume, option B tidal volume, option D dead space, option D none of the above. The correct answer is option B tidal volume. Tidal volume increases to supply more oxygen to the body during exercise. Then the dome-shaped diaphragm separate which two cavities? Option A thoracic and abdomen, option B thoracic and cranial, option C cranial and pelvic, option D abdominal and pelvic. The correct answer is option A thoracic and abdominal. The diaphragm separates the thoracic and abdominal cavity and aids breathing. Which of the following is a common symptom of pneumonia? Option A cough and fever, option B headache only, option C vomiting, option D rash. The correct answer is option A cough and fever. Pneumonia typically causes cough, fever, chest pain and difficulty breathing. The next question, which of the following refers to bluish discoloration due to low oxygen? Option A cyanosis, option B pallor, option C jaundice, option D erythema. The correct answer is option A cyanosis. Cyanosis occur when oxygen levels in the blood are insufficient. Which condition is caused by destruction of alveolar valves leading to reduced surface area? Option A bronchitis, option B emphysema, option C pneumonia, option D asthma. The correct answer is option B emphysema. Emphysema reduces alveolar surface area impairing gas exchange. Then which respiratory tract infection is viral and highly contagious? Option A tuberculosis, option B influenza, option C pneumonia, option D bronchitis. The correct answer is option B influenza. Influenza is a contagious viral infection affecting the respiratory tract. Then which of the following refers to tidal volume of air the lungs can hold? Option A tidal volume, option B total lung capacity, option C vital capacity, option D expiratory reserve volume. The correct answer is option B total lung capacity. Total lung capacity is the sum of all volumes in the lungs. The next question, the narrowest part of the trachea is option A carina, option B larynx, option C bronchi, option D alveoli. The correct answer is option A carina. Carina is the ridge where the trachea divides into bronchi and narrowest point. Then which disease is caused by inflammation of alveoli due to infection? Option A bronchitis, option B pneumonia, option C asthma, option D emphysema. The correct answer is option B pneumonia. Pneumonia is an infection that inflames the alveoli in one or both lungs. The alveoli may fill with fluid or pus causing cough, fever, chills and difficulty breathing. It can be caused by bacteria, virus or fungi. The main cause of chronic obstructive pulmonary disease is option A bacterial infection, option B smoking, option C allergens, option D viral infection. The correct answer is option B smoking. Smoking is the leading cause of COPD, which includes chronic bronchitis, emphysema, damaging airways and alveoli. The next question, normal residual volume in adult approximately, in adult lungs in approximately. Option A 500 ml, option B 1000 ml, option C 1200 ml, option D 1500 ml. The correct answer is option C 1200 ml. Residual volume is the amount of air remaining in the lungs after maximum exhalation, about 200 ml in adults. The last question, which of the following conditions is characterized by inflammation of the bronchus, usually in infants and young children? Option A bronchus, option B bronchiolitis, option C asthma, option D pneumonia. The correct answer is option B bronchitis. Bronchiolitis. Bronchiolitis is an infection causing inflammation of small airways, bronchioles, common in infants and young children, leading to cough, wheezing and difficulty in breathing. Thank you all.